We'll talk about real tools teams are using today to save time, improve the patient experience, and make smarter decisions. They're not big ideas for the future. They're simple, practical ways leaders are using AI now to help their teams work better and stay competitive. So whether you're a dentist, manager, or a team leader, you leave with practical insights and inspiring ideas you can apply right away. So, so let me go ahead and introduce our expert panel tonight. Our first speaker is Reem Alain, the founder of Prime DMS. Reem brings over 10 years of hands-on experience in dentistry, compliance, and practice management. She has worked with more than 70 dental practices and trained hundreds of professionals to build strong systems, stay compliant, and run smoother operations. Welcome, Reem. It's great to have you with us tonight.
Thank you so much, Lester. Thank you so much for everyone who's attending and participating tonight. And we will be discussing something very important for every dental practice and introducing AI maybe in a different way. We tried many softwares relying on AI, and now we know the advantages, disadvantages, and we can discuss that in briefly more with all the panelists tonight. Thank you.
Amazing. Thank you, Reem. And next up, we're thrilled to welcome April Lowry. April leads clinical and AI product operations at Schein One. She helps dental practices use smart technology to work faster, improve efficiency, and deliver better patient care. With deep experience in AI, automation, and practice systems, April brings real-world insight into how technology can truly support teams, not overwhelm them. Welcome, April. It's great to have you with us tonight.
Thank you, Lester. I appreciate you guys inviting me and being here. And thank you to all of our listeners and my co-panelists for lending your expertise to such an important topic. I am a big user and believer in AI and the driving force behind the future of dentistry, and excited to talk about it with you all tonight.
Amazing, amazing. And our final speaker tonight is Dr. Kathryn Alderman. So Dr. Alderman is a dentist, healthcare leader, and AI expert who helps practices use AI in real practical ways. She focuses on improving operations, patient experience, and team performance without losing the human touch. She's the founder and the CEO of Intelligent Care Alliance and is known for helping leaders use technology with clarity and confidence. Welcome, Dr. Alderman. It's great to have you with us tonight.
Thank you so much for having me here. My goal is simple: to make AI easy and available and pretty quick to implement in a dental office of any size.
And the discussion, to kick us off, I want to start at the ground level. AI sounds exciting, but many teams feel friction the moment tools hit daily workflows. So Reem, across the practices you support, what operational or compliance gaps are most commonly exposed when teams introduce AI tools into daily workflows, and why are these gaps surfacing now?
Thank you so much, Lester, for this question. Honestly, I love AI in dental practices, and I love applying those softwares. Is very helpful in any practice, but still, we are facing some deficiencies in certain areas. So we need to have written policies that determine the ownership for the AI, the responsibility, the documentation, provide training to the team how to use the AI tools properly. So I can talk about three things. Starting with the policies, it's very important to determine who will be accountable on the results, the work that have been done by the AI. So if we are, for example, if we are using a software that helps the dentist in writing their notes, so who will be the person who will review those notes before signing? Okay, all those details has to be written in a dental practice, and this is number one. And number two, if we have any issue happen with these notes, the dentist always will be the accountable person about any mistakes happened. So the accountability, according to HIPAA, cannot be delegated to technology, and this is a big thing in using AI. Also, in regards to documentation, sometimes the privacy, we need to make sure that the AI software that we are using from a provider or a vendor that we trust, and we know that the privacy is something very important, especially with the health information in dentistry. So for me, this is also a big issue. I will need maybe to hear more from the expert, from April, from Kathryn, because they provide these things, and absolutely they face those issues and they started fixing them already.
Thank you, Reem. And I think that really sets the stage and of what gets missed early on. A quick detail before we get to the next question. This webinar is awarding 1 CE credit. So if you're listening in, if you stay until the end of the webinar, we will be sharing on how you can receive your that CE credit. So to the next question, let's build on that same talk about results. There's a talk about efficiency, but the reality can look very different. So April, where are dental practices seeing real efficiency gains from AI today, and where are expectations still outpacing reality?
That's a great question, Lester. And I do want to comment real quick on something that Reem said, because I think it's very, very important that we document these pieces for compliance. Because, like she mentioned, you are still needing to be HIPAA compliant and protect patient privacy. And so, offices that are using public tools like ChatGPT may be exposing themselves to potential challenges with that they may not be aware of. And I think as we're looking at the efficiencies that can be gained from AI today, practices that have adopted AI successfully are consistently doing so when they look for low friction areas of the operations that have a high ROI in the workflow. So typically those are going to be things around, answering the phone and scheduling, AI imaging, and anything to do with using the AI to improve treatment planning and RCM and payments. So those three areas are big for operational improvement and how to get those tangible efficiency gains from AI-driven pieces. We see a lot with the AI-driven imaging diagnostics. The voice-enabled tools and the phones and scheduling automation are the three biggest for the practices that we work with. I have a global view of AI, so I work with our PMSs in the US for Dentrix and Ascend, of course, and then I also work globally with the leading practice management systems that we have in each of the European and UK, Australia, New Zealand markets. So we have over 100,000 customers using our practice management systems today across the world. And we are getting requests every day for an AI advice, AI products, and pieces that our teams are all very much working on. I think clinical AI imaging has been available the longest in our space, and we have some great case studies with this where you see the AI diagnostic imaging with things like Detect AI powered by video that improves clarity, boosts case acceptance, in some cases as much as 19 to 20% over those not using AI. I say all the time that AI imaging is something more for the patients than it even is for the doctors and the hygienists. And what I mean by this is that when you're trying to educate your patient on the fact that they may need a root canal, for example, looking at a grave,
So Reem, when AI influences patient communication, documentation, or scheduling, what responsibilities do practice leaders often underestimate, and what consequences show up when those responsibilities are overlooked?
Thank you, Lester. So I see that most of the office managers, they are underestimating, oversighting responsibility. Like we have to check everything that's been done by AI, including like accuracy, checking the consents, privacy. In Ontario, AI-generated communication or documentation must still be reviewed and validated by regulated health professionals. So this is very important. And we see issues when automated systems send messages, populate charts, or schedule care without clear human verification process. If misinformation is shared or recorded, records are inaccurate, the responsibility remains with the practice, not the software provider. This is it.
Oh, all right. Okay. Yes. I think it's very important to be very mindful on how you're using it as well. It's not just you incorporating
We cannot just rely on the AI system. And as April and Dr. Kathryn mentioned, so we cannot apply more than one AI agent at the same time, because applying an AI, it needs specific policies related to that specific AI agent. At the same time, we need to train the team how to deal with it. So when they can, when they're used to it and they can use it properly and everyone knows their role by using the AI correctly, at that time we can add a next step.
Exactly. It should be a step-by-step process.
Exactly. Yeah.
So let's talk about people and roles, because AI adoption affects more than just systems. So April, how does AI adoption challenge traditional roles inside a dental practice, and what organizational changes are necessary?
Quite a few. I think one of the first things that I'll say to that is that I hear a lot as I travel around offices around the country and we're talking about AI at different trade shows and events. People get concerned that, especially at the office team member level, that AI is here to take their job. And I can tell you that from everything I've seen, that is not the case. It is here to augment. It is here to help us do our jobs better and to help the practices operate more efficiently, so that our clinical providers and support staff can spend more time with patients and do things that they need to do. To benefit from automation,
then disrupted.
Okay. Amazing to hear. I think those real-world lessons are important.
Notes in real time and same-day treatments. So those kinds of wins that are super quick with embedded AI tools that are built into the clinical digital workflows, those are the things. But you want to just pick that intersection of operational pain and quick win potential. Forward, where the benefits are visible and easy to see.
Eric is here to help us to make our life easier, our workflows easier and more manageable, so we can focus on the patient care. That's really my big. That's what I see. I just see hybrid teams, or I call them super teams.
All right. Thank you, Dr. Alderman. So with that in mind, I also want to take this into a reflection time of what we have discussed today. So I would like to ask each of you, Dr. Alderman, April, and Reem, what is one takeaway that you can share with us if anyone listening in want to take away from this conversation tonight? We'll start with Reem.
Yeah. So I would say just get prepared and then enjoy the technology.
Exactly. April, what about you?
My one takeaway from this and working with AI to the extent that we do is that AI is here to stay. So the sooner you embrace that idea, figure out how to make it benefit your practice and become a tool that gives quick, easy wins for your team, I think you'll be super pleased with the efficiencies that you're going to gain and some of the things that it debrief. But I think my best advice is that it's time to get on this bandwagon. It's here to stay.
Exactly. Dr. Alderman, what about you?
It makes a mind blowing. If someone comes to me and says, Kathryn, do you want me to make your life easier? And I give you tools to make it easier. And I say, yes, absolutely. I want to have a life that is just easier. And I want to have a practical way. So this is what AI does for you. AI can make your life easier by giving you practical ways to make it easier. So that's why I always tell everybody, use AI, not just in your practice, use it at home, use it for outside of the office to analyze your business stats. But AI is here to make your life easier. You just have to give it a try. And once you do, you're going to be on our team of AI people saying, I don't want to go back because my life is so much easier and I love AI.
You can really focus on really what matters in dentistry, which is patient care. Like you will be focusing, everything will be organized very fast. You will get more patients. You can give them treatment, focus on treating those patients properly. So like, this is really amazing. Like AI giving us this chance to do it.
Exactly. Amazing to hear. I would love to keep going, but I want to be mindful of everyone's time. Tonight has been awesome. So many comprehensive answers, valuable takeaways, and practical